I'm Sandra Buttigieg. I'm the head of Department of Health Services Management at the Faculty of Health Sciences, University of Malta, and visiting research fellow at Aston Business School, Birmingham, UK. The purpose of this paper was to examine the effect of the quality of leadership at the senior management level on social support and on job design. But the model goes further, that social support and job design then were tested whether they buffer the relationships between work stressors and strains. Now, the two work stressors that we have included in this paper are quantitative overload and hostility. Whereas with regard to strains, we have two measures as well, two constructs, namely intention to leave job as well as job satisfaction. So what is extraordinary about this paper is the huge sample size. Thanks to the database that Professor West has as part of the NHS staff survey, and the sample size actually is 65,142 respondents. So it is based in the UK, and therefore it is a nationwide representation. The findings were that quality of leadership at the senior management level explained 75% and 94% of the variance of social support and job design, respectively, whereas work stressors explained 51% of the variance of strains. What is also very important as a finding is that social support and job design also predicted job satisfaction and turnover intentions. So, as regards the findings of the study, the quality of leadership at senior management level predicted, or rather explained, 75% and 94% of the variance of social support and job design respectively, whereas work stressors explained 51% of the variance of strains. What is also interesting is that social support and job design predicted job satisfaction and turnover intentions, as well as moderated significantly the relationships between quantitative workload and hostility as work stressors, and job satisfaction and turnover intentions as strains. So what we're seeing here is the buffering effect that having good social support in an environment that is, at the end of the day, led by the leaders in the hospitals, who are also responsible for getting the jobs designed well and being friendly to the staff that are going to work in that environment. Here, if you have social support and good job design, then the relationships between the stressors and the strains can be buffered. And we have evidence for this. So these findings are useful to management and to health employees working in acute specialist hospitals. However, further research could be done in other countries to take into account cultural differences and also variations in the health systems. Definitely, all research has limitations, and indeed in this paper we refer to the limitations as being due to self-report data, as well as percept bias due to having same source data collection. As regards the practical implications, the quality of senior management leaders in hospitals is they have enormous responsibility, because the impact that they have on the social environment is so important. And the support that they can give to the people working in the hospitals, the job design that they can create, as well as how much there is the buffering of against work stressors, that is also important. So the study argues in favor of effective leadership at senior management level, as well as ensuring that the hospitals have adequate support structures and adequate job designs. The findings may be useful to health policymakers as well as the HR managers.